Hello, I'm Dr. William E. Morgan, President of Parkview University, here to talk a little bit about brain injuries and what we're doing at our facility in the Frisco STAR, Parker Performance Institute. Now, first I'm going to talk a little bit about what happens with blast injuries and what we can do to help treat these patients. When a blast occurs, there's a shock wave that's sent through the air. And even if the person's not hit by shrapnel, there'll be a shock wave that goes through the brain. And since the brain has different consistencies between your gray matter and your white matter, they don't move at the exact same pace, so that there is a shearing force that takes place. Now what happens is the nerves go between the gray matter and the white matter. So what can happen is a shear force takes place and tearing of those nerves can take place. We call that axonal injury. So as you can see here, that where the gray matter meets the white matter, they don't move together. So a tearing can take place that will cause cell death, inflammation, and disruption of normal nerve function. Now here's a real blast in Iraq that takes place a couple miles away. And what you're going to see is a shock wave coming across the desert. It looks like a white line. Watch how that comes at thousands of feet a second, moving towards this soldier. So even though he was miles away, I can almost guarantee that soldier had axonal damage take place. The next video is going to show someone launching a mortar. We just saw two blasts downrange. Here's somebody who's actually firing artillery, a very small round of artillery, a mortar. You can see the overpressure that takes place. That mortarman has probably fired thousands, if not 10,000s of rounds, each one causing a micro trauma, each one causing that axonal shear or the shearing that I just talked about. So that's what happens in blast injuries, but this will affect us with many injuries: a car accident, sporting injuries, a trip, a fall. If you're into martial arts, taking blows, that can also occur. We also find one sport in particular has been yielding a great deal of concussions, and that is women's soccer. And there's a reason for that, but one of the reasons is that women's soccer has more injuries than men's soccer. Is men tend to do a lot more upper body exercises, so it helps stabilize the neck. But again, when a ball hits somebody's head, when you head, or if God forbid you hit somebody else's head when you're trying to head the ball, you will get the same effect or similar effects to what we would have with a blast injury. And what happens is you have disruptive impulses. Now, there's advanced imagery that actually can look at normal impulses and connections across the brain and abnormal connections across the brain. When you get that injury that I talked about, your brain might look more like the image on the right, where you have a disruption of normal neuronal impulses. Here's some of those images that we would see at Walter Reed when I worked there. Here's normal. Here's a brain with broken connections, and you can see the difference. What we've done at Parker Performance Institute is to create an institute that focuses on treating these type of brain injuries. We have novel treatments there to help enhance the development of new pathways to increase neuroplasticity and heal the brain. Our tagline at Parker Performance Institute is performance enhancing healthcare. It is our goal to take brain injuries like this and do what we can to maximize the recovery. And we've had great success. Parker Performance Institute providing world-class clinical education, research, enhanced care for your most complicated patients.